Welcome, everybody. I guess we're going to go ahead and get started. Megan, are you on the line with us?
Yes, I am.
Okay. Well, we want to thank everyone for attending today's webinar, Rural SARTs, What the Research Tells Us. We're going to go ahead and get started. Let's get started with today's webinar topic. Joining us on the line to present today's webinar is Megan Greeson, who is the Assistant Professor of Psychology at DePaul University. Megan, welcome.
Great. Thanks so much, Kai. So I conducted the National Sexual Assault Response Team project and led it in collaboration with my partner, Dr. Rebecca Campbell. So I'd like to thank her and my colleagues from the National Sexual Assault Response Team project for their contributions to this work. I'd also like to thank the National Sexual Violence Resource Center for hosting this webinar and for having me. And I'd like to thank all of you out there listening for joining us and giving me the opportunity to share our research with you. So before I get into it, I wanted to give you an overview of our webinar today. So first I'm going to give you a brief introduction to our research on SARTs and rural SARTs. So I'll talk about why we wanted to conduct the research, and I'll give you some details about how we went about conducting the project. From there, I'll jump right into our findings. So first I'll discuss what we found about the characteristics of U.S. SARTs. So how on a national level we're seeing SARTs are working, how they're being structured and functioning. From there, we'll be jumping into the information about factors related to SART's effectiveness. So part of our study sought to understand what factors promote or hinder SART's effectiveness, and those are the findings we'll share in that section. And then from there, we'll go specifically into rural SART strategies. So we talked to rural SARTs in particular about what they saw as strategies for overcoming some of the barriers that they associated with being a rural SART team. We'll go through those findings together. And then at the very end, we'll have plenty of time for both any questions and comments, as well as a discussion of implications of this research for a rural SART practice. Before I get into the research project, I want to take a second to talk about terminology. So today's research project, the findings are pertaining to SARTs, but sometimes we use that term SART differently, so I want to make sure we're on the same page with that. Sometimes the term SART is used to refer to the specific trio of one police officer, an advocate, one medical forensic examiner that responds to one particular survivor. In the context of this project, in the context of this webinar, I'm really referring to the term SART as a multidisciplinary collaborative group that has representatives from the legal, medical, and advocacy systems, and that they work together and take a step back and say, okay, how well are each of these systems responding to sexual assault in our community? And then they try and take action to improve that. So like I said, I wanted to give you some sense of the aims of our research project. So the basic impetus of this project was I wanted to better understand SART's effectiveness, and in doing so, help contribute to the development of resources that could help promote SART's effectiveness. We all want SARTs to succeed, so I wanted to collect high-quality information to help us do that. So the first basic aim of the study was, it was very basic, honestly. We did a national study, and we wanted to understand how on a national scale are SARTs working. What are they doing? How are they doing the work of working together as a collaborative group? From there, like I said before, we also were really interested in better understanding the factors that hindered SART's effectiveness or, on the other hand, promoted their effectiveness. Prior research on SARTs has shown that some SARTs seem to be more effective than others. So some are able to create improvements in victims' help-seeking experiences and in legal outcomes. Others are less successful. We wanted to see if there were certain ways of operating SARTs that seemed to be more or less effective. So the first step in conducting this study was we had to kind of go back at the very beginning and create a comprehensive list of as many SARTs that we could identify in the U.S. as possible. So this didn't exist. So instead, we engaged in a lengthy 9-month multi-stage process where we contacted a variety of different organizations to try and identify all of the SART teams that exist in the U.S. We ended up with a list of over 800 teams that engage in some form of multidisciplinary collaboration in improving the response to sexual assault. So there's collaboration ongoing between more than one multidisciplinary group, or between multiple stakeholders and they were working together to improve the response to sexual assault beyond just providing referrals to one another. So that's a lot of teams. From that 800 group then, we chose a random sample of groups that met as a multidisciplinary team on a regular basis and at least served some adult victims. So we excluded the child-only teams from this particular study. So we took that random sample and we conducted interviews with 172 SART teams from that random subgroup that met regularly and at least served some adult victims. And overall, we had a 92% response rate. So what that means is of the people that we asked to participate, 92% of the ones that were eligible agreed to participate and did complete an interview with us. So what that tells us is that we have good quality information that should be representative of SARTs across the U.S. With those 172 SARTs, we asked one person to participate in a phone interview with us and report about their SART on behalf of their team. So we didn't talk to the whole team, we just talked to one person from each team. From there, we specifically tried to talk to the current SART leader. So sometimes the current SART leader wasn't available, so we talked to the past leader or a long-term member, but generally we were trying to speak with the SART leader. In those phone interviews, the SART leader or the interview participant reported on their team's operations, how their SART is working, but they also talked about their perceptions of the SART's effectiveness. So it's important to note here when I'm talking about this particular study and how we define SART's effectiveness, the SART leaders were asked questions about, to what extent do you think your SART has contributed to various improvements? That had to do with improving victims' help-seeking experiences and improving legal outcomes. So again, it's important to note that this is a measure of perceived effectiveness from the perspective of the SART leaders or the longtime members. And while it would have been great to get kind of harder, more objective information on changes in victims' help-seeking experiences or changes in legal outcomes, that wasn't possible on a study of this scale and scope. So instead we went with the leaders' perceptions of the effectiveness. So like I said, the interview participant reported on both their team's operations and their perceptions of the SART's effectiveness. And then we also talked to them about what they saw as challenges specific to their team and some strategies they used to promote their SART's effectiveness. Okay, so next I'm going to transition into talking about characteristics of U.S. SART teams and our findings related to that. Sorry, okay, here we go. There we go. Okay, so we conducted interviews with a total of 172 SART teams, and we found them to be in all 4 regions of the U.S. Most were, or 31% were in the South. Only 15% were located in the Northeast. 28.5% were in the Midwest, and 25% were located in the West.
We have a quick poll here asking everyone what portion of SARTs do they think are rural. If you'll notice above the chat, there should be a feedback section where you can select A, B, or C. Megan, it looks like we're getting a lot of B.
A lot of B, as in boy?
Yep.
Okay.
Yep. Looks like everybody's picking 2/3, or majority of people are picking 2/3 as the answer.
Great. Okay. So you guys were very prescient. Yes, that was what we found in our study. So of the 172 SART teams we interviewed, we found that 2/3 were in fact rural, and we defined that by looking at the community that the SART served, and based on national guidelines, looked up their census data to see the population density of their community, and for communities with less than 500 people per square mile, they were termed a rural SART, and that did constitute 2/3 of the people that, or 2/3 of the team that participated. We also asked the SART leader or member to report on different aspects of their SART's history and some other characteristics of their SART. So I'll go through that with you too. One of the things that I thought was particularly interesting was we asked SARTs to report on when their team first started, and if, since their team had started, they'd ever had to disband and then reform their SART. So was there ever a time when your SART stopped operating and then had to reform before you're able to get back together? We found that actually 14% of the teams had this experience where they had fallen apart and had to reform. Of course, the other 86% had only ever operated continuously. And then from there, we also found that on average, the SART teams had been in continuous operation for about 8 years. We also asked the SART participants to talk about the different sexual assault stakeholder groups that were involved as active members of their SART team. And by that we meant people that were involved in SART meetings and other SART activities on a reasonably frequent basis. So we had a list of 18 different sexual assault stakeholder groups that might participate in SARTs. The interview participant indicated whether each of those different groups was represented as a part of their team. We found that the vast majority of SARTs did have active membership from what I call the big four stakeholder groups. So that's those primary sexual assault responders that we spend the most focus on usually in SARTs. So rape victim advocates, medical forensic examiners or SANEs, police, and prosecutors. From there, we also looked at the typical or average number of different sexual assault stakeholder groups that people selected. Out of 18 possible, there was an average of 8.5 different stakeholder groups involved on the average SART, and that constituted 12 unique organizations within their community. In another section of the interview, we asked the SART member to report on their perceptions of their team's goals. And specifically, we asked them to choose between two different goals. Choose the goal that their team spent the most time and energy on. So not just what's most important in their minds, but which goal they, as a multidisciplinary team, spent the most time and energy working on. So when asked to compare the importance of improving survivors' experiences or victims' experiences of seeking help versus improving legal outcomes like conviction rates, the majority, or the vast majority really, 84% of the SARTs indicated that improving survivors' experiences was something that their team spent more time and energy on than improving legal outcomes. Only 8% said that legal outcomes was more of a priority, and 8% said that they were equal. So when comparing the importance of improving survivors' experiences of seeking help versus engaging in prevention and education as a team, it's 87%. So again, the overwhelming majority said that improving survivors' experiences was the goal that their team spent the most time and energy on, while only 8% said that their team spent the most time and energy on prevention education. And then finally, to compare the last two, it was split a little bit more evenly. We found that 59% of SARTs said that their team spent more time and energy on improving legal outcomes versus about a third, 36%, indicated that prevention education took up more of their time and energy. Okay, so those are the main characteristics of SARTs in the U.S. that I wanted to start with sharing with you. So from here we'll go into the information related to SARTs effectiveness. And as you'll see, we're going to cover two types of data about SARTs effectiveness. So first, in the interview, we had different survey questions that we asked people about specific factors that we thought might be important for SARTs effectiveness. And then later on in the interview, we asked questions in a more open-ended way where the SART members themselves had the opportunity to tell us what they saw as the factors that would improve or be a challenge for their SART. So you see both types of findings. I'm going to start with the survey type data first.
This time we're going to do a quick chat. If everybody could take a second to enter the response into the chat to the question, what do you think would be key to effectiveness? Some of the responses are coming in. Looks like collaboration, communication, and they're coming in quick, so I can't catch all of them here. Okay, Megan, if you want to go ahead.
Okay, great. So it looks like we've got a lot of interesting answers, and people talked about a lot of different characteristics that might affect how successful a SART is at achieving its goals. Like I said, in the survey portion of the interview, we had a few specific factors we wanted to look at. We were particularly interested in how the SART organizes their team. So by that, I mean 5 key things. So the first one we call formalization, and it has to do with how formal versus informal the SART team is. So it was how they used different formal structures and resources to organize their team. And we'll talk more about that and what that means in a second. The next few issues were different collaborative processes that are recommended for SARTs to engage in. So that includes multidisciplinary case review, where different disciplines sit down together and review how they responded to individual cases to make sure that people are responding appropriately and to troubleshoot any issues that they might be having. We also looked at whether the teams are engaging in multidisciplinary cross-training, where different stakeholder groups trained one another about their own roles and limitations in responding to sexual assault. We looked at policy and protocol adoption and review, so adopting different policies and protocols for how different sexual assault stakeholder groups should be responding to sexual assault cases. And then finally, we looked at formal program evaluation of the SART as a team. So first I want to show you how SARTs fell out in these different categories. So the first was formalization, and we asked the SART member to report on whether they use each of 13 different formal structures or resources to help organize their team. So that included things like, does your SART have a formal leader, as well as things like, does your SART have a mission statement or take meeting attendance and have meeting agendas and so forth. So there's a possible, they could use from 0 to 13 possible different structures. And on average, SARTs used 6 1/4 different structures. That was the average across all the SARTs in our study. Then for each of those collaborative processes I talked about, we asked, does the team engage in this at all? And then from there, we asked the team member to report on whether they did that on a regular basis, so that they'd really institutionalized that into part of their team process and did so regularly. So we'll go through how often that happened. For the first one, which was multidisciplinary case review, we found that about 3 in 4 SARTs, 74%, are engaging in multidisciplinary case review. So the majority are doing that. But on the other hand, only 42% are engaging in multidisciplinary case review on a regular basis. For the next one, we found a similar amount were engaged in multidisciplinary cross-training, so 76%, but only 38% were doing those cross-trainings on a regular basis. Policy and protocol development, adoption, and review was the most common. That was engaged in by 83% of SARTs. The vast majority are having some kind of protocols or policies that they've adopted, but only 32% were either developing or reviewing those on a regular basis. The final one we looked at was formal program evaluation. So we asked SARTs whether they engaged in formal program evaluation as a multidisciplinary team. We asked them to describe that. We found that overall, only 15% of the 172 SARTs that we interviewed were engaged in formal program evaluation as a group. So the key here is remember that I'm talking about as a SART team. So we really probably would have found many more SARTs were engaged in program evaluation by looking at whether the individual organizations themselves were doing an evaluation. But instead here we're trying to capture were they evaluating their team as a whole, and only 15% were engaged in formal data collection or analysis around that issue. So we wanted to work with that information in a very specific way. We were trying to understand, okay, if these represent different ways of organizing a SART team, are there different types of SARTs that exist that differ in how formal they are and their use of these different collaborative processes? So we used the data in a specific statistical analysis that I can provide more details on if anybody's interested. But we put the data into the statistical analysis and found that a specific solution that was the best showed us that there was 3 distinct SART types. So I'm going to go through each of those different types of SARTs that we found. And again, they differed in how they used these different processes and structures to organize their team. So the first group we termed the low adopters, and this represented 65 of the 172 teams, or 38%. So compared to the other two groups, on average, the SARTs that fell into this group weren't as formal. They used less of those formal structures and resources to organize their team, and they had less cross-training going on. So they were either not doing cross-training or they were less likely to be doing so on a regular basis. They were also lower on policy or protocol development and review. So if they were doing it at all, they were less likely to be doing it on a regular basis. They were similar to the other two groups in multidisciplinary case review, and none of the SARTs that fell into this type were engaged in that formal program evaluation as a multidisciplinary team. In the second group, we called this the high adopters accept evaluation. So you'll see that overall the pattern was they tended to be high on most things. So compared to the other two groups, they were more formal. They used more formal structures and resources to organize their team. They were more likely to engage in multidisciplinary cross-training and to do so on a regular basis. And they had higher adoption and review of policies and protocols. So again, they were more likely to do it, and if they did engage in policy and protocol development, it was more likely to be on a regular basis. They were similar to the other two groups on multidisciplinary case review, but one of the key highlights here was that none of the teams within this group engaged in that formal program evaluation. In our last group, and this last group comprised 16% of the sample, so only 27 of those 172 SARTs. This was very similar to the high adopters without evaluation group, but the key distinguishing feature was that all of the SARTs that engaged in formal program evaluation were sorted into this type. So they also had higher formalization, they also had higher cross-trainings, higher policy and protocol development compared to the other two groups. They were very similar on multidisciplinary case review, but every single one of the teams that engaged in evaluation fell into this group. Okay, so part of our aims, again, was to understand, are there different types of SARTs that vary in how they organize their teamwork? And we found, yes, there's these different types. We looked at the patterns and came up with these names for them. But then part of our interest, too, was to say, okay, are these related to effectiveness? Do these relate to how effective SARTs perceive themselves at improving victims' help-seeking experiences and improving legal outcomes?
We'll just take a quick minute to have another quick poll here. Which SART types do you think would be most effective? A, the low adopters, B, the high adopters accept evaluation, or C, the high adopters plus evaluation? You'll find right above the chat in the feedback section where you can post your answer. Looks like we've got an overwhelming over 90% are picking C, the high adopters plus evaluation, Megan.
Okay, great. So let's go ahead and take a look at that data. Before I go into it, I want to let you know that we looked at 4 different types of effectiveness. So we looked at, one was related to improvements in victims' help-seeking experiences, so how much the SART was helping to improve how accessible and responsive those formal systems were to sexual assault victims. And then the other 3 types of effectiveness that we looked at were related to legal effectiveness, so improving the processing of sexual assault cases in the legal system. The first was the extent to which the SART helped improve victims' participation in the criminal justice process, so making that easier, making that happen more regularly for victims. The second was the extent to which the SART helped improve the processing of sexual assault cases by the police. And the third was related to improvements in the prosecution of sexual assault cases. Like you all seem to have predicted, the low adopters were universally perceived as the least effective. So again, this was based on the SART leader or long-term member's perception of their team's effectiveness, and we found that those low adopters groups, the SARTs in that group, were perceived as least effective across all 4 domains of effectiveness. We were a little bit surprised, though, to find that the high adopters plus evaluation and the high adopters except evaluation were actually quite similar to one another. and the high adopters plus evaluation was only perceived as more effective on one of those 4 domains of effectiveness. It was the extent to which the SART contributed to improvements in victims' participation in the criminal justice system. So that was the only one in which that added bonus of doing evaluation seemed to have an effect. So one of our goals was to look at those different types of SARTs and see whether that related to effectiveness, but we also looked at one other issue related to how the SART team was structured or how it organized itself, and that was the SART team's membership. So again, we asked SARTs members to report on the number of different sexual assault stakeholder groups involved in their team out of a total of 18. And we found that teams that engaged more stakeholder groups as active members of the SART team actually had higher perceived effectiveness on all 3 types of legal effectiveness. So when more different types of sexual assault stakeholder groups were involved, they tended to perceive themselves as more effective at improving victims' participation in the criminal justice system, police processing of sexual assault cases, and the prosecution of sexual assault cases. So next I will go into that other part of the interview data where we talk to people in a more open-ended way about the different factors that they perceived as contributing to the effectiveness of their SART or hindering it. But before I move into that, I want to quick stop and check in and see if we have any questions for the group to share about the data I presented thus far.
If you have any questions, you can certainly enter them in the chat box.
Megan, this is Sally. We had one question that came up wanting to know specifically how you define prevention in your research. If you wouldn't mind sharing that, that would be helpful.
Okay. So as we all know, there's a lot of different ways of defining prevention. So if you're looking at primary versus secondary or tertiary, in this particular interview, we just asked them to what extent they felt that their team prioritized prevention over and education over other outcomes. So we didn't define that for them. We just let the participant define that for themselves in that particular instance.
We do have 2 other questions, Megan. Jenna Harper wants to know, do you have this data available in a report form or another way we can access, sorry, the screen just shifted and besides this webinar?
Yeah, we do. So I should have mentioned that earlier. We do have a technical report that we wrote to the funder that's available. Sally just put the link up there for us in the chat box. So that's a technical report. It's pretty researchy that we wrote to the National Institute of Justice who funded the project. And then we're also working on a practitioner report that's going to be a lot more practitioner friendly and really kind of focus on the big picture and what the findings really were. And we'll have less technical details about how the research was conducted. And that we're hoping to have available by the end of the summer.
Megan, one of our staff here has a question for you as well.
Hi, this is Babs from PCAR. I was wondering what average case review means, how often, and how many cases?
That's a great question. So average case review, what that meant was that those 3 different groups I talked about, the low adopters, high adopters except evaluation, and high adopters plus evaluation, it meant that they were similar to one another and how often they were doing case review. So that's really all that meant, was that those 3 groups were similar. We did find that most of the teams, about 3 out of 4, were engaged in a multidisciplinary case review, but that only a little over a third of them were doing so on a regular basis. I don't remember the exact numbers related to how often. If they did do it on a regular basis, we asked them, how often are you doing that? Are you doing it quarterly? Is it monthly? What's going on with that? I don't have that specific data off the top of my head, but if anybody wants to email me contact information, I would be happy to provide that specifically. We also didn't, unfortunately, ask how many cases that they were reviewing at those multidisciplinary case review meetings. It was more just trying to get at, are you even doing that in the first place? But I do think that would be really interesting information to be asking SART teams in the future.
Thank you, Megan. We'll go ahead and let you continue with this section here.
Okay,
and,
great.
Get more questions towards the end.
Okay, thank you all for those questions. So like I said, now I want to go into some of the information we collected from teams about what they saw as the different factors that were either promoting their effectiveness or were hindering it. So what I did with this section is I really focused in. I re-reviewed my data specifically for this webinar, and I went through to look for specifically what factors were unique to SART teams that were rural. So I'm not going to go over every single thing that promoted SART's effectiveness or was a challenge for it. So I'm probably not going to touch on some of those things that you all brainstormed in the chat earlier. But keep in mind that the idea here was to focus in on which factors seem to be unique to the rural SART context. One of the first key challenges that came up as a theme was people feeling that they were having difficulty because of norms within rural communities. So kind of a sub-issue within this area was people talking about the community or even sexual assault stakeholders or responders having this attitude that sexual assault and things like that doesn't happen here in our community. We have a nice town, it's a small town, that doesn't really happen that often here. So that was one of the challenges that they faced. Another similar and related issue was feeling like that in a rural community, in a small town, that people had this attitude that sexual assault was something that should be taken care of within the family. So rather than seeking help and going to the police or going to the medical system or advocates to deal with the issue, people seem to have this sentiment that, no, we should take care of those kinds of personal issues within our family. So SART saw that as a real barrier to helping get people to seek help. Another challenging norm that was discussed was an issue of feeling like victim blame was particularly strong within their rural community. So this was definitely a theme that came up across all types of SARTs, but people seem to think that this was particularly a problem within their rural community, that people were more likely to blame the victim, suggest that the victim was responsible for what happened, or engage in skepticism around whether they were really assaulted. So clearly that was another challenge to both education and outreach efforts. Another challenging norm, since I know there's kind of a long list of them here, another challenging norm for those rural SART teams was noting that within their community they felt like because it was a small town, there was kind of an established in-group and an out-group. So that if you're in the in-group, you were perceived as being quite credible and upstanding member of the community, versus if you fell into the out group, you might be more marginalized, you were perceived as less credible, and things like that. So they felt that that connected to treating victims inconsistently based on whether they were in the kind of the in crowd versus the out crowd. So that was another big challenge around being a rural team and rural community norms. And then the last sub-theme in this area was that they really felt that in rural towns, and some of them particularly talked about in conservative or religious rural towns, this was especially an issue, that the issue of sexual assault was a taboo, that the community perceived that as something that is just not something that you talk about, and it's especially not something that you talk about in public. So they found that was a real challenge to getting out into the community and engaging in outreach, helping get people to know about services, helping educate people about what sexual assault is, especially in the schools, because people didn't think that was something that was okay to talk about. So now, hopefully you have a sense of what those challenges were. But for each of these, what I want to do is also talk about the different strategies that the teams use to overcome that. So we probably have more data on the challenges than the strategies themselves, but I think people had some very interesting ideas for what their SART team could do to overcome those. And hopefully you'll find those particularly interesting for the rural SART context. So the major strategies for dealing with these rural SART norms that they found challenging were really around education. So one thing that people talked about is even though it was difficult to educate people, even though it was hard to get out there and try to be preventing sexual assault through education or engaging in outreach to help people learn about various sexual assault services and be willing to use them if that ever happened to them, even though they had all those barriers to that, their strategy was you just have to keep at it. So even though it might feel like hitting your head against a wall, a brick wall, you just got to keep going after it and keep trying and trying and trying to get in there and make that education happen. So that was, I think, a big lesson learned for those SARTs, was to really keep at it in a persistent way. Another strategy that was used in this area that I also thought was quite interesting was that people talked about getting the entire SART team involved in outreach and education efforts. So I think in a lot of communities, the Rape Crisis Center tends to be doing a lot of the primary prevention or even a lot of the outreach and the education efforts. And instead in these SARTs they were saying, no, we as an entire SART team, so we're going to include all the different stakeholder groups, and all of us as a team are going to be involved in determining what outreach and education strategies need to be happening, and also making sure we're all out there doing those. So as a team, including a nurse and an advocate and a police officer, they would go out and they would pass out information about sexual assault services, or they would teach people about what sexual assault is. So they had a much more multidisciplinary approach to sexual assault, and they thought that was helping them really get the word out there and be more effective at doing so. A third strategy related to these challenging rural SART norms, I just called it creative outreach strategies, for lack of a better word, but I think a lot of us are used to the more traditional outreach strategies, like a very common example is people doing prevention and education in the school systems, right? So that was, with people doing the creative outreach strategies, we're kind of thinking outside of the box about how can we be teaching people about what sexual assault is and and what services are available to them if that happens to you. So one of the examples that I remember was a woman who was involved in her SART talked to me about how to get the word out there in more informal settings. They were educating hair salons. So they're actually going into hair salons, giving out information about the services for sexual assault victims, and then above and beyond that, they were training the hairstylists in how to identify people that had been victims of sexual or domestic violence and how to give them referrals. So I thought that was a very creative use of outreach, and that was another way they were just trying to get at the education in as many different ways as they possibly could. Another team talked about doing prevention and education work in their local bars. So again, these were different ways of trying to get the information out in just more ways in more different places within the community. The final theme around strategies for overcoming challenges due to rural norms was really thinking about doing targeted outreach to unique communities. So one way to think about this is, any SART has its one coverage area that it tries to deal with, right? So that's often one county. Within these SARTs, they weren't doing the same thing across the whole county. They didn't have a one-size-fits-all outreach and education approach. Instead, they would think about the unique geographic communities within their coverage area, and they'd also think about the unique communities of identity. So maybe racial subgroups, LGBT groups, men, so forth. And they would think about those different subgroups within their community, and they'd think about which outreach and education and prevention efforts are going to be most effective for those unique communities. So they really tried to be thinking about a tailored approach, and that was going to work best for specific contexts that were happening within the broader community that they served. So the next theme that came up about a challenge specific to being a rural SART was dealing with confidentiality for victims. So this seemed to be, while this can be a problem for victims in any community, people really saw this as a unique challenge within rural SARTs, partly because of just how small the communities were. So typically they talked about this manifesting as victims being afraid of reporting or seeking help from formal systems because they were being afraid of being outed as a rape victim. So they didn't want people to find out that they were a rape victim, and they were afraid that because their town was so small, just by the fact of going to the Rape Crisis Center, for example, people would know that that had happened to them. Another similar related fear was that they were afraid that if they did seek help, that whoever responded to them, whether it be a police officer or an advocate, a prosecutor, medical forensic examiner, or a nurse, they were afraid that they would know that person. So they were afraid that they were going out to seek help after being victimized and that they would actually have to deal with having a responder that was someone that was involved in their personal life. And so people felt that that was a real challenge for getting people to come forward and take advantage of services or to report the assault. So
Megan, we had who, I'm sorry, had a quick question. Terry Allison wants to know, do you have any information on whether there was any dramatic change in those who used the entire SART in the outreach education?
That's a great question. Yeah, I don't have any information on that specifically. So in this section, we were really just asking the SART members to say, what do you think helped your team be more effective? So what I can say is that some people thought that that did make their team effective, but I don't have any additional information on that at this time. But I do think that would be a great question to be asking.
And if we can just take a minute to answer one more question.
Yeah, great.
Melissa Gilpin wants to know, did any of these SARTs report difficulties with hospitals maintaining SANE programs or having a lack of forensic examiners?
Absolutely. Yep. So I've got a slide coming up in a second, and we will. So I will come back to that issue in just a minute. Great. Okay. So the last challenge that I was talking about was this issue around victim confidentiality or survivor confidentiality, feeling like that was particularly difficult in these small towns. So again, the emphasis for overcoming this was really around that education and outreach again. So they talked about if people are afraid to come forward because of fears around confidentiality, it was even more important to be getting the word out there about services that are available and services are free and services are confidential. So they really tried to emphasize overcoming those barriers by educating people about what was out there. And the other thing was they tried to give victims options so that they were aware that this was a limitation in their community, that they were so small that victims did have a chance of knowing the person that they were reporting to or seeking help from. So they tried when that might happen to recognize that and give the victim the option and say, okay, would you rather work with someone else? Again, that wasn't something that, was necessarily the thing that they wanted to do in the first place. They would have rather had the person they didn't know from the start, but at least gave that victim an option. And then the other strategy around this issue that they engaged in was educating the responders themselves. So making sure that they really emphasized with the sexual assault responders from all of the different systems that this is something that survivors are concerned about or victims are concerned about, that they're worried about confidentiality. So just really emphasizing them and helping them to understand that barrier so they would continue to keep that information confidential and private, and they would understand the importance of offering those options to the victims. Okay, so here another challenge that people talked about was challenges due to communities that were geographically or socially isolated. So again, SARTs have that broader coverage area that they're trying to serve, and they were talking about specific pockets within that broad coverage area that were particularly geographically or socially isolated. So this could be specific areas like specific towns, or it could also be specific populations within the community. They talked about those pockets were perceived as separate or apart from the areas with services. So it might be that they were actually physically very far away from where in that coverage area the services were located, so kind of an outlying town versus all the services were in the center of the county. Or it could have just been an issue related to social dynamics. So they talked about some particularly rural communities in a mountain area feeling like people felt distinct from the community where the services were provided and therefore were unlikely to actually come to that area to use those services. And then compounding all of this, of course, was that there was a lack of systematic and affordable transportation. So they talked about victims having to drive very far, spend quite a bit of money on gas to get to services, or having other transportation-related barriers that prevented them from being able to access services or report to the police in a quick and easy and accessible way. Okay, so what were some of the strategies? How did they deal with this? So I think the general sense here was that they tried to meet the community where they were at. So one issue was that they were trying to, that they worked with their SART team to identify SART members, so the actual sexual assault stakeholders themselves, that had a connection to those isolated communities. So either they were from those communities or they really understood those communities pretty well. And then again, they tried to really tailor what they were doing to that specific community. So the SART member could give them that expertise about how can I understand this social community, how can I understand this physical community that feels distant from where the services are, and then they would tailor their outreach and education efforts to make sure it matched those community norms. And then another unique strategy, which isn't necessarily universally feasible but was very interesting to me, was that they talked about taking services to the people. So rather than having one place where services are available and victims had to come to those services, they talked about different methods of taking the services out to the people. And again, this wasn't common, but I do think it was a really great idea. So one example was a woman that talked about being a rape crisis center advocate. The rape crisis center is typically located within the middle of the county. There were some areas of the county that were really quite far away from that, so it wasn't really feasible for people to be meeting with an advocate and have to drive several hours. So instead, when that happened, she would go out and she would meet the victim or the survivor out in that outlying community at the local police station, and the police station gave them that access. So through that coordination, the SART team was able to find a way to get the victims access to advocacy services in that more outlying community. I know again that that puts a lot of burden on that advocacy group, but I did think that was a very unique strategy and worth sharing with everyone. And then this relates to the question we just had. I forget who asked it. I apologize. But when people were asking about having trouble getting the same program or staffing sexual assault nurse examiners within the hospitals. So I think overall, the broader theme that I heard from people, the broader challenge around being a rural SART, was that they just talked about having a lack of services or expertise in-house. So in their own community, they didn't always have the services they wanted or the expertise they wanted. So one common example was just sometimes services were not available, like we just don't have that in our community. A really common one was mental health services. We just don't have mental health services for victims in our community. So they talked about that being really difficult because obviously you can't link victims with services if they're not available here, so they'd have to send victims out to the next community. A related issue was that they often lacked more specialized services that we'd really prefer to be able to offer victims. So this included having difficulty actually having something like a SANE program where those SANEs are providing specialized care where they really have that expertise in working with victims. So those more specialized services weren't always available. That other examples included not having a child advocacy center or not having a specialized prosecutor's office, not having detectives that were specially trained in sexual assault crimes. So because they were a small town, they have smaller departments, they have a smaller population, they have a smaller caseload, they didn't have those services that were truly specialized to the needs of sexual assault victims. Another theme within this area was feeling like they had a lack of experienced providers. So they had people that were doing the work of responding to victims and responding to cases that didn't necessarily have that much experience specific to sexual assault. So it's kind of related to that specialty area, but the issue here was more that because the rural caseload was lower, or because they were often getting less experienced providers coming to their community when they were hired, that people just weren't as experienced with working with this specific population. So they felt that those people were a little bit more green and weren't necessarily bringing that expertise to the table. And then, so you have these issues, and then that was compounded by people talking about the particularly high cost of training for rural SARTs. So when for anybody, training can be expensive, but if you're in a rural community, they don't typically offer the trainings in your area. So you have to fly your team, or you have to transport your team to get to those trainings, or you have to fly a trainer out to you. So they talked about that additional financial burden of trying to get training within their local rural community. And then similar to that, they also talked about lack of funding their staff generally. So the services were there, but it was just that they didn't have enough funding, they didn't have enough staff members to be providing as many services as they wanted to be providing to the community. Or maybe they weren't able to provide the services on a 24/7 hour basis. Okay. So again, this is where I would consider where that question came in. That was one of the examples of they didn't have those specialized services. A lot of SARTs talked about having problems getting a hospital to provide or house a sexual assault nurse examiner program, or if they did have a sexual assault nurse examiner program, being able to staff that and being able to staff that with people that had a lot of experience. Okay, so generally the strategies here had to do with forging connections outside of their own local community, so they had their coverage area, and to deal with these problems, they just really worked on forming relationships outside of that coverage area. So here they really stressed the importance of having a really solid referral network outside of the community. When certain services weren't available, they couldn't control that. They obviously wanted to be providing those services, but they couldn't. So they made sure that they had a really strong referral network so they can say with confidence, okay, this is where you go to get that service to the victims. When thinking about the lack of specialization and the lack of expertise and experience, SARTs often made connections to neighboring programs and neighboring SARTs in different communities. So I remember one of the sexual assault nurse examiners talking about she was the SANE coordinator, but she was still a fairly young SANE nurse. She hadn't been doing SANE exams for that long. So she made sure to build a relationship with the SANE program in the next county over. And then she had somebody to go to process issues that she was having and that she could work with as a mentor. So they're able to help borrow that expertise from that neighboring program. I also heard about SARTs as a whole, that whole multidisciplinary group operating in a similar fashion. So the SARTs themselves would say, okay, we're struggling with this issue of around being a SART. We're having this problem around, say, turnover or sustainability. And they would talk to the SART in the neighboring county about, okay, have you guys dealt with this? How did you deal with it? So they're able to share that experience and expertise and go out and seek that out from local mentors. And then another common strategy for these issues was really taking advantage of accessible state and national resources. So I know this isn't happening everywhere, but in some states, states are providing technical assistance and training that's free and is actually really specific to sexual assault response teams. So Minnesota is one example of a place that's doing a lot of work at the coalition to provide communities with technical assistance and training around how do you operate a successful multidisciplinary group. So a lot of these rural SARTs tried to take advantage of these more accessible and free resources that didn't require them to bring in an expensive trainer or send the team to attend an expensive training. Another example would be taking advantage of national resources that are available online or available for free, like the National SART Toolkit. I think Sally has linked us to that at some point in the chat box. Okay, so again, those were the general strategies for dealing with we don't have those services or we don't have that expertise or knowledge in-house, and they would go out and get it outside of their community. Okay, and so and this was the next challenge that was specific to working with rural teams, and people talked, sorry, I just saw that question, so could the presenter define rural again? Okay, so in our study, we asked the SART what community they served, and then we looked up in the census the population density of that community. And based on what the federal guidelines for what constitutes a rural team is that they should have 500 people per square mile or less within their community. So that's how we decided what counted as a rural team. And that's how we ended up with 2/3 of the SARTs as rural in our sample. And however, in this part of the interview where people were naming their challenges or naming their different strategies they used to help improve their team, we just let them decide if they were rural or not. So this was about really what they saw as being specific to being a rural team. Okay, so I'll go back to the challenge again. So in this challenge, they were really having, they talked about the difficulty of kind of operating as a SART team because of the context of being a rural sexual assault responder. So a big issue they felt was that when you're a small community, there's a very limited group of sexual assault responders, right? So there's fewer people that work at the Rape Crisis Center, there's fewer nurses, there's fewer police. So overall, the pool of sexual assault responders is much smaller. And one particular concern that people had was as a SART team, they felt that they were afraid that if they needed to bring up an issue with another team member, in other words, call them out on some kind of problem or issue that needed to be dealt with, they were afraid of people getting defensive and then disengaging from the process. And then because there was such a limited or small group of responders, then they would not have certain stakeholder groups represented on their team. So they're really afraid of burning bridges with the few sexual assault responders that existed in their community. Another challenge that had to do with working together as responders in the rural context was having to deal with not only the confidentiality issue where the victim might know their responder, but they also had to deal with the issue that sometimes the responders knew the assailant. So they knew the perpetrator of the sexual violence, and that represented a challenge because often they felt that even responders that pretty well understood victim blame and understood the need to treat people responsively and so forth, they felt that sometimes that could be blurred if the respondent knew the assailant and saw the assailant as an upstanding member of the community, for example. So they really had to deal with how are we as a SART team going to deal with this issue of when the responder not only knows the victim, but when they know the person that's being accused of perpetrating the crime as well. And then the last sub-issue in this area was feeling that in particular as a rural community, it was a small community, and that people were kind of set in their ways in their community. So they saw this as responders being really resistant to change. And again, this is another challenge that we saw in other types of communities, but people really saw this as particularly a problem in rural areas where people seem to be more set in their ways, again from the participant's point of view. This presented problems for us trying to talk with stakeholders about, okay, can we change how we're responding to survivors? Can we adopt new policies and programs? Can we try different ways of working together? That really got in the way of engaging in those types of collaborative activities. So what were the corresponding strategies to deal with that? Again, we can talk about all the challenges all we want to, but how do you deal with this? So here people really emphasized education again, but also they really emphasized the importance of ongoing positive relationship building. One of the interesting things, I think we all know that relationship building is important in SARTs, but what they saw as particularly crucial in the rural SART context was not just building relationships with other organizations, but actually bothering to build relationships with people. And in some ways, the rural context actually helped people to do this because they did have a smaller group of sexual assault stakeholders and responders. They could get to know the people as individuals and not just sexual assault stakeholders. So they're able to build both a professional as well as a personal relationship. They felt that that made the collaborative relationship all the more stronger. They also discussed the importance of tailoring any efforts in working with a particular sexual assault responder toward them as a person, again as an individual and not just the sexual assault stakeholder. So depending on the person's personality, the person's communication style, their history in working together, they would approach different issues in a more tailored and specific manner. So if they needed to call someone out, like was discussed before, or if they needed to process a problem or a conflict that was happening, they would think carefully about, okay, what's the best way to approach that with this particular person? A third strategy that was also emphasized was really engaging in a lot of non-judgmental education. So we know that SARTs do a lot of work around educating sexual assault stakeholders, educating one another, and how to effectively respond to victims and process sexual assault cases. And they talked about the importance of educating one another, but doing that in a way that was non-judgmental. So rather than accusing people of doing something wrong or judging them for how they've done something in the past, trying to come at it from a more supportive and a positive manner so it didn't elicit that defensiveness and didn't make someone want to disengage from the process. Again, this was something that came up in other types of SARTs too, not just those rural SARTs, but I think that people really thought this was particularly important when you had such a small group of players who really knew each other well in that small community. And then I think the final one, this one might be more of a piece of advice than a strategy, but the final strategy that was talked about related to this issue was that as a SART coordinator, a SART leader, or even just a SART member, that any SART, there's always going to be disagreement and there's always going to be some kind of conflict, and not everybody is always going to be on board with every single thing that happens. So they talked about the importance of remembering that and recognizing that they as a SART team wanted to have support for one another, and they always wanted to have that broad-based support, but that they couldn't ever achieve universal popularity. So there's not ever going to be a time when every single person in a collaborative group is 100% perfectly happy with everything that's happening. So they just tried to remind themselves of that and focus more on achieving broad-based and positive support. Okay, so we're almost done with this section, and then we'll move into our time for discussion, but I want to share this last challenge. So an additional challenge that SARTs faced was achieving consistent participation from different sexual assault stakeholder groups. And I think this came up with the most often with police, and you'll see why. So they talked about how in rural areas as opposed to more urban areas, they have a much larger number of police jurisdictions. You'd be working with an awful lot of police departments, and if you tried to get every single police department that had a jurisdiction in that county or that community to participate, that was a lot of police jurisdictions to bring to the table. In part, this was a challenge in getting people to meetings, but it was also a challenge in getting people to agree because there was just that many more different organizations involved. So on top of that, compounding that issue is that oftentimes these police departments were extremely small. So they had very small numbers of police on staff, few full-time officers. So on top of having a small department, you only have a few people covering the road and covering the office, and then you want to take away one of those full-time people to go to a SART meeting. So that was something that was hard for those small police departments to make that time for one of those few officers to be a part of the SART meetings. And then on top of that, they also talked about difficulty with consistent participation from all types of stakeholders, but including police, because of geographic distances in these rural communities. Oftentimes they had very large, spread out rural communities. They didn't have public transportation, so people would have to travel several hours to just simply attend a SART meeting. So of course that was a challenge to making sure that people were consistently involved in those SART meetings. Okay, so what did people do to deal with this? They really tried to just improve their meetings or provide incentives, give people more reasons to want to come as much as they could. So several people talked about really focusing on having very productive meetings. So they talked about we're only going to meet as an entire SART team only when we really need to. And when we do really need to, we're going to make sure those meetings are especially productive. We're never going to meet for the sake of meeting because we know that's too much of a strain on those organizations. So they really focused on making their collaborative meetings effective and only really when needed. But then to complement that, they also talked about instead of always meeting as a big group where you have to find one time when everybody can get together, even though some people are really far away, they talked about instead of doing that, they would have specialized meetings with subgroups of people when something needed to happen with a subgroup of people. So those were the only people that needed to be there and needed to do something together. Then they had a meeting specific for them and didn't have to try and get the entire group together, which made it much easier for them. Another strategy that was used was to take the meetings to different members of the SART teams. So some of the rural communities talked about rather than having whoever was the SART leader, rather than having the SART meetings at their organization, they would take the meetings around the county or around the community to the different organizations that were members of SARTs. So while some of those rural SART police departments couldn't always come and attend those SART meetings, couldn't take an officer away to travel to come to the meeting, they could host the SART meetings occasionally, and that way they could be there during those meetings that were at their own location. Another common strategy they talked about was having a central location where it minimized overall the amount of distance that you would travel. So focusing on which meeting space was most important for getting people there rather than which meeting space was associated with the SART leader, for example. And then the final example, and this came up a fair amount, was providing food at the SART meetings. They really saw that providing food really helped incentivize, give people an extra reason to come, and also provided that more informal and kind of personal way of engaging with one another. And that was really helpful in getting more consistent participation from their point of view. Okay, so those were the major themes that we found related to what people saw as challenges and strategies specific to being a rural SART community. So we have about another 20 minutes, so I'd be very happy now to move into taking your any questions that you might have about the research, how we conducted the research and the findings, and then we'll also have time for discussing the implications of this research for rural SART practice. So thank you very much.
Thank you, Megan. If anybody has any questions, you can go ahead and enter them in the chat box below. While we're waiting for those to come in, Megan, were there any links that people can go to kind of get information about some of this information in print form to review?
Absolutely, yes. So like I talked about, and Sally I think posted the link in the chat, we have a few resources that I can provide. So one is that I and my colleague Rebecca Campbell wrote an article that reviewed all of the previous SART research. So not the research I presented today, but all of the stuff that had been done before that. So that link is now up on your screen. And then another resource is that technical report that I discussed that was the research-focused report to our funder, the National Institute of Justice. And that's available free as a PDF through that link. And then again, we're also working on a practitioner-focused report of these findings. That's not available yet, but I do have a list of people that are interested in getting that sent to them by email. And if you want to get added to the list, you can send your contact information to me, and I will happily add you to it to make sure you get it once it's ready.
Looks like we've had a few questions come in. Julie wants to know, when you say that you should review the protocol on a regular basis, how often is regular?
We found that the protocols were probably reviewed less frequently than, say, people were engaging in case review. And that probably makes a lot of sense. I think the people that were doing it regularly, the most typical way of doing it was reviewing their protocols on an annual basis, or occasionally every 2 years. But I think the annual basis really seemed to be helpful to folks. It gave them an opportunity to refresh everyone's minds about, how have we agreed that we'll be responding to sexual assault stakeholders. But it also gave them an opportunity to say, okay, are there any new best practices we need to be thinking about that have come out, or are there any new policies at the state or national level that we need to make adaptations to our own local policies in?
And Jessica wants to know, do you have any recommendations around combining CCRs and SARTs in rural communities?
Okay, thanks, Jessica. That's an interesting question. Our research didn't really look at that specifically. We did ask a question at the end, and we said at the end of the interviews, and we said, hey, so are there any other local task forces or coalitions or those types of things that that your SART members are involved in? And we did find that the majority of the time there was kind of some other task force or coalition or something going on in their community on a related issue, whether that be domestic violence, CCRs, or some other topic. But we didn't look specifically into whether or not they should be combined. I think that from my perspective, just my personal opinion, this isn't based in the research, but you do have a lot of similar players and you do have a lot of similar issues. So bringing those different groups to the table could be to one table and dealing with that all together can reduce the amount of meetings people have to go to, can reduce the amount of meetings people have to coordinate, can kind of make it more efficient. But on the other end, I know some communities have felt like when they did that, then some of the focus was taken away from one of the two issues. So for example, people were more comfortable about discussing domestic violence in a community. So when they combined the CCR and the SART, they really lost that focus on how do we better serve sexual assault victims. So I think it has its pros and cons, and it might be worth really exploring what's the most beneficial in our own unique context.
And then Stacy asked, did any of the SARTs report challenges in sharing resources, cooperation between other SANE programs? My apologies, another question came in and all of a sudden everything had shifted there. Or champion organizations like women's centers?
Yes, so that did come up in our data. I don't know that this was specific to being rural, but it was a common challenge, and our list of challenges is pretty darn long. So we'll also have more data on the full list of challenges that will come out too. But yeah, there was some those strategies of reaching out and developing collaborative relationships with other organizations did sometimes have its drawbacks, and I know sometimes there was feelings that there were turf wars where some kind of organization felt like, okay, you're on my turf, and there was more of a competitive focus between the two rather than really developing a how can we help one another out. And I also know, especially with SANE programs and being the ones that are located in hospitals, there were some challenges discussed around hospitals saying we're a business and we aren't going to refer victims to the hospital with the SANE program because we are providing quote-unquote clients or money to that other hospital, which is our competitor. So I know that was a challenge a lot of SARTs and SANEs have faced. I wish I had the answer to how to fix that, how to address that, and I don't know what exactly that is, but I would, that's definitely not something that's only happening to you if that's happening in your community.
And then Randy wants to know, did the agencies provide a list of creative events or activities that they use to help with outreach or education, specifically in terms of public events to help educate community members on sexual assault?
Hi, Randy. Thank you. No, we didn't ask them for that specifically. So instead what we just said is kind of, can you tell me what do you think's been helping your SART succeed? So if that came up, they did discuss it. But I don't have a comprehensive list of all the creative events or outreach or activities. I do know a lot of people just talked about the importance of education outreach generally, and then I gave you a couple examples where people were going into the hair salons or the bars. I can make sure that as we disseminate this information further and continue to analyze the strategies that we pay attention to that and can try and get that information out there, but we don't have a comprehensive list at all.
All right, we do have another one here. Susan said, our funding and resources in our city and county are very limited. Can you recommend a great website to gather educational materials for community outreach? We are a newly created SART.
Great. I know I'm partnering with them right now, but I think the National Sexual Violence Resource Center has a lot of great resources, both for community education and outreach, as well as sexual assault response teams, and how you can build a SART and how you can maintain successful relationships in a SART. So that's a website I would highly recommend, but I would also, encourage any other the members of the audience to chime in about other websites that they found to be helpful as well.
We still have a few more minutes, so if anybody else has any other questions they'd like to type in chat, we can certainly take those.
This is Sally. And I know there was a question that came up, I think, from Laura Williams about how you defined case review, because I think as we've been doing technical assistance around SART issues, we're finding that some communities define that very differently. So it'd be great if you could share what your working definition was around that.
So for the particular research we conducted, we just said, does your team engage in multidisciplinary case review in which multiple disciplines or different stakeholder groups sit down together and discuss individual sexual assault cases? So the idea was there had to be more than one stakeholder group. There had to be multiple stakeholder groups in the room, and that they were discussing those as a team, and they were looking at individual cases. So it wasn't like they were looking at the stats and cases as a whole. They actually had to talk about one case, one sexual assault case. We didn't set any parameters around or any guidelines for how many cases they had to review when they did those. And then from there, we just asked, okay, if you're doing that, how often are you doing that? Are you doing that on a regular basis? We generally found that most teams that were doing case review regularly rather than as needed tended to do so on a monthly or a quarterly basis.
It doesn't look like we have any other questions coming in at this time. I'm sorry, we just had one come in. It says, Stacy wants to know, do you have any links for evaluation tools?
Yeah, we do have. So one of the tools that's available is the SANE toolkit. So I'm not sure if people are familiar with that. This is a project I was involved in too, but more as a helper. It's designed specifically for SANE programs, but it could be adapted to be used for a SART team. And it helps you, it takes you through the step-by-step process of assessing your impact on legal outcomes as a SANE program. So I do have a link to that. Sally, do you have that? Can you put in the, there she goes, she's got it. So it's another NIJ report, but this one is written specifically for practitioners for SANE nurse audience. So it's not that technical researchy report that I was talking about before. And it really walks you through how do I evaluate this program.
All right. Megan, if we can go ahead and probably wrap it up now since we are running close on time here.
Okay, great. Before we get off, I would just like to thank all of you for having the opportunity to share my research with you, and I'd also like to thank all of you. I probably called some of you and asked you if there was a SART in your community. I might have even interviewed some of you, and I'd really like to thank all of you for your participation in the project and this webinar. We have my contact information up on the screen, so if you're interested, please contact me and I can put you on the list of people to receive the practitioner report.
We'll also be continuing this conversation on the SART listserv with Megan. So if you're interested, you can certainly sign up. The link there is at the bottom of the slide, and I believe Sally has posted it a couple times in the chat as well. Thank you, Megan, for joining us today and sharing all that information with us. We'd like to take this time to remind everyone that if you have any questions or are in need of technical assistance, you can contact us here at the NSVRC by mail, phone, or email at resources.nsvrc.org. And as we close up, we'd like to thank OVW for funding today's webinar, and we'd also like to thank all of you for participating today and hope that you found the information helpful. Over the next few weeks, we will be taking the recording as well as the transcript from today's webinar and be posting it on our online space. If there's no other questions, then we'd like to thank everyone and wish you a great day.